got the next case is a middle-aged man, sole breadwinner for his family, who's had a road traffic injury, slipped off of his motorbike, and since then he's not been able to lift his arm. And the MRI has shown a massive rotator cuff tear, and if you can see, he's got a good 5 millimeter of retraction. The problem with these is loss of function, but more importantly, if it's left to its vices, the humerus travels proximally and starts eroding the acromion, giving him arthritis, and would require a bigger operation. Just very quickly going through the procedure itself. Now you can see the subscapularis from the front. His condition from the previous patient is different. I'm just checking the glenoid and the humeral surface, but if we go further, we will see that he's got a tear in the subscapularis, which you would notice if you were to do ultrasounds, the fibrillations that you see. It's at the insertion that you would note. And this is the muscle that you use to give somebody a hug. And this is quite important to grab and grasp things. I've looped the suture across arthroscopically into the muscle, and I'm going to make an anchor or an awl and peg it into place into the humeral head, and use a bioabsorbable screw to stick it back into place. And generally, prior to going to the top or the supraspinatus where he's had a tear, we tend to check whether this is working or not. And you can see now that we've restored the texture and the quality of the muscle in the front, and we know that once we rehabilitate, he will have an improved outcome. Moving on to the top, he's got a severely retracted supraspinatus muscle, and it needs a lot of clearing out before we can bring it back to the humeral head. Once the clearing is done and the stitches are passed through and an awl has been made, the anchor is passed into just outside the articular margins of the humeral head to pull all the muscle back into its place. And a double check, this gentleman has had a double row repair. He's required 2 anchors to push everything back into the place. Speeding through, these anchors are pegged into place and stitched up, and general subacromial clearance has been done. He's also received PRP in this shoulder. I'd like you to guess which shoulder was operated on, and I can take those comments later, just because right now this presentation is going live on social media, so we can hold on to the questions afterwards. He's very pleased. He's back to earning and putting food on the table for his family, and he's quite pleased.